Welcome to the first of these conversations. We try to do one or two a semester, and as we were planning this year's, we had sort of two goals. One was really to try to focus a lot more on the topic of the health effects of climate change as an important theme for our school for this year. And then the second was to kick it off with someone extraordinary. And I would say we have accomplished both of those with this session. Really, when I sat down with the team and said, what's our wish list of who we would like, my first thought was, well, it's a long trip from Seattle, but let's see if we can get Chris Ebi to come all the way. And you are extremely generous for doing it. So
thank you.
Thank you for being here.
Thank you for the invitation. Really appreciate it.
Yeah, it's great. So we have a mix of students and faculty and staff, and I always like to start with the question of, tell us your story. A bit about how did you get into this field? You can go back further. Where'd you grow up? How did you get interested in public health? But it just would be helpful as a little context setting, because then I have some questions that follow the trajectory you followed. But if you don't mind, just a little bit about yourself.
I've always been interested in science from the beginning. And so I have various degrees. I've got a degree in biochemistry, a degree in toxicology, and those made it quite clear I wanted to work on issues that more directly impacted people. And so then went into public health and worked on a variety of issues in public health, informed, of course, as one always is, by one's thesis advisors. I had the amazing Millicent Higgins, who was just phenomenal to work with, and continued to work around a range of environmental issues, ultimately ended up at the Electric Power Research Institute, where I was working on electromagnetic fields, another complicated, marginalized area at the time. EPRI had a group that was working on climate change. They were working primarily in mitigation. They went to the negotiations for the Kyoto Protocol. And at some point, the first paper was published about climate change and health. And EPRI is an unusual research institute. It's funded by the electric utility industries worldwide. It does no lobbying. And it is responsive to the kinds of questions that they have. And one of the questions was, the first paper was on malaria, saying that the rates of malaria were going to explode with climate change. It's the mandate of EPRI to provide the evidence, the scientific foundation for decisions that are taken. And the executives in the industry wanted to know, is this something we're going to have to worry about? And so the bottom line is they asked me to start a program, and I did, in the 90s. So I've been working on this from the beginning in climate change and health. And one of my good colleagues from that time likes to say, all of us could have met in a phone booth, which is not as much of an exaggeration as it should be.
Yeah. So let's go back to the early days of thinking about this intersection, which I think is clearer to people now than it was then. Climate change was largely, well, first of all, it was still not something that was talked about widely. I mean, obviously, you had Vice President Gore talking about it, and you had some other political leaders, but it wasn't widely discussed in Washington. But more relevant to this conversation, the linkage to health seemed tenuous, or maybe really not the point in some ways, or at least as I understood sort of how people thought about it then. First of all, do you agree with that characterization? And then second is, so how does someone like you, who's really interested in health issues, start in this field? And just talk about that experience and talk about what that sort of first set of papers, I mean, my first paper of yours that I became aware of, I think was published in 1999. Maybe you've had earlier ones of that on this topic, but kind of what was the reception in the academic community in terms of this linkage?
A couple of comments about that. One is, when I started, climate change was a marginalized issue. And there was no question about that. And that meant the people working on climate change, and I mean across all of the issues on climate change, was a close-knit community. And it's not to say that we all got along, it's not to say we all didn't have disagreements, but it's a small community and you respected everyone because they're working on an issue that's marginalized. They see the importance of it. They understand the implications for societies, for ecosystems, and understand that there really has to be research to support decisions that will be taken. And it was very much looking not just today, but into the future of what could happen under different greenhouse gas emissions. And so the community itself was very supportive of each other. The other comment is, as things evolved, I've never seen an issue in health like climate change in health. Everyone talks about raising awareness. Everyone talks, and I know you've got questions about engaging with health policymakers. This is a field where we had prime ministers and presidents talking about climate change and health, and the health funders not doing anything. President Obama talked about climate change and health in an asthma ward, and NIH did not respond. And so the awareness has been at the highest level, but not necessarily at the level to release those funds. And I think part of the reason is the heads of most of the medical research councils, NIH, have been physicians. They've been medical doctors who have a medical model view of the world. And environment is not part of what they look at. And so that has been the hardest part to get to move. The other pieces, if you've got your president talking about it.
Right. It's hard to raise awareness more than that.
There's no other place to go, right?
Yeah.
Yeah.
But let's stay on this for a second. The NIH, well, first of all, they have funded public health research, which gets away from the very narrow medical model. They obviously have funded other environmental exposures work. So what do you think the difficulty in the kind of intellectual leap was to go from that to linking it more broadly to climate change? Like, why has that been hard for the research funders and other scientists too? I mean, not just the funders.
At the beginning, it was a marginalized field. So people were not paying attention to it. But it's also the information they had about climate change was from the media. And if you go back to the Framework Convention on Climate Change, Article 2 of the convention gives the ultimate purpose of the convention, which is to prevent dangerous anthropogenic interference with the climate system. And it does not mention health. It's an environmental issue. And what we heard, even at places like the World Health Organization, was this is an environmental issue. Others should bring this up. I had a meeting years ago with someone high up in the Bill and Melinda Gates Foundation who said health is never going to fund climate change work. Go talk to people in agriculture, have them fund it. And so there was this perception that somehow somebody else was going to do the funding. World Health Organization, WHO, was on board with a group within WHO from the beginning, but it was hard to get them totally engaged across the range of issues. And of course, they're now leaders in that. And so it's the perceptions of you've got an environmental problem. It comes through the Minister of the Environment, often is based in the Met Services. And I've helped WHO run many meetings. I've yet to be in a country where people in the department, Ministry of Health, know people in the Met Services. They're very different worlds. And trying to bring those together has taken quite some effort.
Yeah. All right. Just staying kind of historically on some of the challenges in the birth of this field, and I'm going to ask you after this, like what your sense of the field is today, which obviously feels to me at least different. But how about their sort of reception to these topics or issues inside the medical world? Not the funders, not necessarily WHO, but among researchers at universities. My sense is that community was slow to this as well. And I can tell you my own experience of that when I started the Global Health Institute. I took over the Global Health Institute at Harvard in 2015 and said, this is going to be one of our top 3 priority areas. And pretty much everybody, both on the health side and the environment side basically were like, you're nuts. This has nothing. They're just not related. And that was 2015.
Right.
So why has the medical and public health community been slow to this?
It's a really good question, and it's hard to understand, but it has been incredibly slow. I know one of the questions that will come up is some issues around the funding space. And in order to get funding, and I'm thinking specifically at the moment about international funding for adaptation,
Yeah.
it's both a push and a pull. And so there's various large institutions that have large sums of money to move adaptation forward. And they have guidance for the health sector, and yet they've had very few applications because the awareness in ministries of health has been really quite low. I have, in my career, met one person in public health who had any training in meteorology. And so this is something that people don't really know about, they don't really understand, and training is incredibly important to help build capacity. And a lot of the effort has been focusing on building that capacity. And you're right, it's really shifted in the last 5 to 10 years.
Yeah.
With lots of interest in medical schools, with people. I work with someone who works half-time in the emergency department, Jeremy Hess. He sees people coming into the emergency department because of climate change. And so the emergency physicians are really quite proactive in this space, saying not addressing climate change is affecting what I see in the emergency department. And that shift has been recent, and it's welcome. It's really important.
And what do you think has prompted that shift?
It's a range of issues of, as the research, the corpus of research built, that there was more awareness that in fact there are associations and that we can start quantifying what kinds of consequences are occurring. A big shift is underway at the moment. There's a field in climate change called detection and attribution that does exactly what the name implies, detects whether there's a change in a trend, and then attributes some part of that trend, in this case to climate change. And we now have 15 to 20 studies, not a large amount of studies, but we've got studies now that are demonstrating, they're quantifying. I live in the Pacific Northwest, that heat dome in the state of Washington caused over 440 deaths. And that event was virtually impossible without climate change. So now it's possible to stand up and say these people died because of climate change, which makes it a public health issue.
Yeah.
Because we know that people are dying from climate change, not just that we have associations.
Yeah. I've also seen versions of that for big storms. We've
Yes.
always had big storms. We're having more big storms now, and attempts to quantify how much bigger was this storm
Right.
because of climate change, and then what was the health effects of that.
Right.
So that's a really important attribution area. We've talked primarily about what's happening. We talked about a little bit about WHO, but primarily around funders in the U.S. What is this landscape? Since so much of your work has looked at the world outside of the United States, particularly in the Global South, how has this issue played out in the Global South? One could tell a story to themselves that, well, the health issues, there are so many other big pressing health issues in the Global South that this would be lower on the agenda. But you could also tell the story of the threats are so much greater in the Global South that it would be much higher on the agenda. So which of those two stories is closer to the truth?
Both.
Okay.
There is a process under the Framework Convention on Climate Change, because there are articles I could quote if you want in the convention on focusing on the most vulnerable. And one of the first things that happened was there was a process to develop in the least developed countries national adaptation programs of action, NAPAs. And those were mostly through the departments of the environment, the Met services, but some of the countries started to include health. And as those then evolved to the national adaptation plans that every country is doing, and then now we've got the nationally determined contributions, that for the low and middle income countries, there's funding for these processes from UNDP and UNEP. And increasingly, health has been involved in these. And so the health department, the Ministry of Health, is now hearing from the other sectors about the kinds of consequences of climate change and are realizing that includes their mandate. And so the interest from the ministries of health has increased quite a bit by engagement in these processes. And it has been slow.
Yeah.
Some countries are way out ahead. Other countries are not. And you see across a wide spectrum. But as more capacity is built, as there's more discussions at the level of the ministers, then the ministers are hearing how important it is for them to focus on climate change and health.
Yeah. It struck me last year, I think, at COP was the first year that we had like...
First health day ever, yes.
Tell me more about your sense of both how that came about and the impact of this. Like, part of what I've been thinking about is the health sector ready to get serious about climate change? And I can mean that in like 6 different ways, and I'm sure you can probably add 4 more things to that list. I may come back to what the health sector should be doing in a second. But how much of an inflection point did that feel like? And do you feel like...
It was enormous. There has been increasing engagement from WHO in the COPs.
Yeah.
And the COPs are incredibly complex events. A good colleague likes to say it's your first COP, you're a tourist, because it's just such a complicated arena. And one of the things that institutions, countries do is they have pavilions. And the pavilions are where they have their own side events. So they have people come and speak about a range of issues. In the last couple of years, WHO's had its own pavilion, which was a big shift. And that meant more of the negotiating teams would come and hear about health issues. They also heard about it in other venues, but definitely heard about it in the WHO. And WHO is now more engaged across the UN and has made some real significant advances in ensuring health is part of the agenda. And I'm sure there was lots of negotiations behind the scenes with United Arab Emirates to make sure that health was an important component. It was also because United Arab Emirates is quite concerned about what climate change is doing in their region and what the health consequences are. The temperature, the dust storms, changes in the geographic range of vector-borne diseases. So there's mutual interest on both parts. And they worked together for this health day. It was the very first health day. And part of what they worked on was getting pledges. And these are pledges, they're not checks, but they were pledges of actually starting to work on climate change and health. Before the health day, when you looked at all of the international funds under the Framework Convention on Climate Change and Health, it was less than half of 1% of all the money that had been dispersed. And most of that was in the last couple of years. The Health Day came forward with $1 billion in pledges. Some of it is various forms of greenwashing. Some of it are enthusiastic pledges that will not be fulfilled. But that is a significant shift. And you could really feel it when you were there, that
Yep.
Suddenly there was all of this attention on climate change and health. It was in all the pavilions and all of the discussions. And going forward, it will continue to be a key part of the Framework Convention, which is really going to change how we think about the field, what kind of work we're going to do in the field, the emphases we're going to place.
Great. I have a couple more questions, and then I'm going to open it up to the audience. So think about questions you have for Professor Ebi. So let's talk about what health systems should be doing. And if we talk about low-income countries, and let's say you get access to resources, you can think about mitigation, you can think about adaptation. If you're speaking to a minister of health, let's pick a big, complicated country, India. Mm-hmm. Talking to the Minister of Health of India, India has had enormous heat waves, a whole set of things that are probably being exacerbated by climate change. India has plenty of other health challenges. It's also a country that's very dynamic with lots of innovative and interesting things happening. Where should India, and I don't mean to pick on India, you can pick a different country if you want, but where should India be investing? What should it be focused on if it wants to make its health system and public health infrastructure effective and resilient in the age of a changing climate?
Two main buckets. One, in climate change, we call adaptation, which is basically public health. And deeply incorporating climate change in all that they do. There's no policy and program, there's now starting to be, but there never was a policy and program developed considering climate change. And that has all kinds of consequences. Excellent heat wave early warning systems in Ahmedabad, other places in India, but they were designed making assumptions about when heat waves would start, when heat waves would end. It's changing.
Yeah.
How do you think about doing this? And this is an area that is extremely challenging. It's a lose-lose situation. In India, their first national assessment, and I'll talk about that in a minute, but they have a map of the current distribution of malaria, the future distribution of malaria. They do not overlap.
Say more? Why would they not?
Because with rising temperatures, mosquitoes are going to disappear in some places. They're going to appear in new places. You've run programs. How do you take choices? If you stop a malaria program too soon, children die.
Right.
If you don't start one soon enough, across the entire age range, people die.
Yeah.
You're not ever going to get this right. And this is going to be really hard for public health because we're conservative. We want to be right. We want to make sure we protect people the best we can within limited resources.
Yeah.
And I think we have to confront directly that we are going to make wrong choices because we'll never have sufficient information. It's, we won't know until we have that outbreak. What you do at a country level, adaptation is very much cognizant that all adaptation is local. You do have warning systems that are at a national level, but most adaptation is local. And so when I go into a country, I come in to provide technical support on climate change. I'm not the expert. They know their capacities, they know their weaknesses, they know the challenges they're facing. And it's working with them to incorporate climate change into how they do their business. And helping them to do so, they will make the choices that are the best for them. The most powerful example I have of that is I was at one of the COPs many years ago. I think it was around 2000, 2001, I don't remember. If I had the dates, it would marginally help. There was a presentation about a massive storm that occurred in Mozambique. Extensive flooding. 1 million people were affected. 15,000 people were rescued from trees by helicopters. One woman gave birth in a tree, and her daughter was celebrated throughout Mozambique. And there was one slide in this presentation of the health consequences. Number one, the floodwaters, of course. It was so extensive. Then I always ask my students, what else do you think was on that list? Massive flooding event, what do you think happened? Food security, big issue, water security. They actually did a good job on vector-borne diseases. Interestingly, always in American audiences, the students say snake bites, which I think says a lot about American audiences, but not a lot about Mozambique. And what nobody ever says is that number 2 on the list was landmines. It was just after the Civil War ended. The landmines washed down from highland areas. It was mostly children that found them. And I said, it's a powerful example of I don't know, right? I can tell you about climate change. I don't know what your choices are. I don't know what choices are best for you. And so to deeply incorporate that in working with countries. There's processes that are established under the UNFCCC, vulnerability and adaptation assessments. WHO has 2 guidance documents on how to do these for health. 60, 70 countries have undertaken these. So there's well-known processes to work through how you set your priorities, because that's hard. The other thing that countries have to do is reduce greenhouse gas emissions. 5% of all greenhouse gas emissions worldwide are from healthcare. 2% are from airplanes. How many articles do you hear about airplanes and their emissions, and how many you see about healthcare? In the US, more than 8% of our emissions come from healthcare. We have to get the emissions down. The healthcare industry is inefficient in so many different dimensions. There's so many opportunities to get those emissions down. And the more that the high-income countries find ways to do this, develop new technologies, the more it helps the low and middle-income countries. You can transfer the technologies.
Yeah. I was thinking about that flooding story reminded me. I wrote recently about the storms that hit North Carolina, Florida, Helene, and Milton, and the picture that sort of stuck in my head that sort of prompted this piece was a picture of a hospital with a bunch of people on the roof getting rescued. The hospital was in a town that I think it was 1,500 or 2,000 feet above sea level. Never thought it was going to get flooded.
Right.
And this whole thing has had me thinking a bit about, and I was going to get to a question for you, is we know from Hurricane Maria in Puerto Rico, right? The official death toll was 60, and then when Caroline Buckey and folks at Harvard went back 6 months later, lo and behold, about 4,500 people had died.
Yeah.
Because the initial storm kills a small number of people, but then all the downstream effects, right? The healthcare disruptions, the people missing dialysis and chemo and can't get to their, like all the stuff. That paper was in the New England Journal in like 2017 or something. So it wasn't like no one's heard of this. Around major storms, I still don't see health systems thinking, how are we going to protect our most vulnerable? What kind of outreach do we need to do? What about our people on dialysis? If they can't get in, where are they going to go? Like there's just a ton of thinking and work that needs to be done. Even moving generators out of the basement and putting up on the roof or wherever. It's still not happening. Or certainly not in big numbers.
Right.
Why not?
I'm a big advocate for stress testing. And stress testing has a history from wargaming, from, if you look at banks, all banks have to undergo stress tests. And so there's a group of us who've been really advocating that healthcare has to do this. Humans as a species are terrible at looking into the future. My favorite story is Thomas Watson. When he was head of IBM, is when IBM developed the first personal computer. And it was presented to him, right? Here's the first PC. And here was someone who's paid a lot of money at the time to run a major multinational company. He looked at this thing and he purportedly said the worldwide market for these was 10. When my kids lived at home, I'd cornered the market. We won't talk about today. We're not going to talk about what I have today. We just are not very good at this.
Yeah.
And stress testing is a way to get around this, of developing these desk-based exercises. Well, first of all, you need everybody in the room. All the relevant sectors need to be in the room so you can talk about all these downstream issues, because we continue to run into them. The Pacific Heat Dome in Portland, there was an assumption that they could use their light rail system to get people to the cooling shelters. Rails are tempered to a particular degree. It was too hot to run the light rail. They could run it, but not at the rate they needed to. There's thousands of examples where we're just not realizing the whole basket of possible consequences. And stress testing is a way to get people out of current thinking into realizing the future is going to be different. There's no uncertainty at all. The future is going to be different. And how to think about that different future and be thoughtful about what we need to do, when we need to do it, and start taking action. Because if we don't, we're going to continue to see these kinds of events, which is really, really unfortunate.
Unfortunate and feels increasingly predictable
Yeah.
and increasingly frustrating. All right, last question before we open it up. For students, let's put into two buckets. Sort of think of our students, the practitioners, the master's students, some of the undergrads who go on to work in public health. And then we have our doctoral students. Many of whom will go on to be academics, but some of them will go work in other areas, but are much more scholars. Not to say our master's students aren't scholars, but they're going to be practitioners, the practitioner degree. Advice for those two buckets of individuals, if they care about this topic, how do they engage in it? What do you think the future of this is? If you want to, how do we navigate what are going to be complex political times over the next few years? Wherever you want to go, but I just would love to hear kind of your thoughts on how we should be advising our students who listen to you, who look at the data, are concerned this is a really important public health challenge, want to play a constructive and helpful role, but are trying to think about how do they do that?
I'll start with the researchers. If you look across the corpus of literature published to date, about 2/3 of it's on heat. The next big bucket is dengue and malaria, and then it's everything else. There's hundreds and hundreds of climate-sensitive health outcomes. So I often talk with students who say, well, what about, have you researched? The answer is probably no, that research hasn't been done. A fact we haven't discussed is there's been no funding in the field. I have 2 or 3 papers on this. The funding at NIH until about a year ago was less than 0.02% of their budget. So this is a field that's done what they can with no money. It wasn't different in the EU, it wasn't different in Canada, although it changed with Justin Trudeau. It's changing in Australia. So it's changing quite rapidly. So there's enormous opportunities to ask a research question. You don't have to worry if it's going to be unique because there's so little that's
Probably
been
hasn't
done.
been done. Yeah.
It probably hasn't been done. So it's, for creative minds, there's lots of opportunities here. And the funding is dramatically shifting. NIH is now funding climate change and health for the first time. There's Rockefeller, there's Wellcome that are putting money into the space. And so there's quite a significant change in that landscape, which is great. It's an enormous opportunity. Where to start? Start with whatever you're interested in. With so little being done, the opportunities are pretty endless. And start at what scale you're interested in, if it's local, if it's international. There's lots of ways to engage in this. For the MPH students, finally, departments of health are really starting to look at this issue, are realizing it is a core issue that they have to face, and more are looking for people who've got some training, that they can bring people in who can help them think through their strategies, help them focus, help them prioritize in the context of other challenges that they face. And so I think it's a great time to be coming into the field because it's changing so quickly at the moment. And what will happen in the next 4 years, we don't know. I will point out a couple of things. One is much of the rhetoric you're hearing right now is disconnected from reality. So pronouncements of getting rid of 600 people from big agencies. The head of the agencies can't do that. There's something called the civil service. And so the challenges for making those changes, as you well know, is incredibly high. It's going to be a combination not just of what the new administrators for these agencies think they can do. And by the way, when you look at any federal agency at the change of an administration, there's what, 4 people that are politically appointed in these huge agencies. There's only 4. The rest of them are civil servants. And if you look across any conservative administration, these agencies have accomplished a lot. People are dedicated, they do their job, they keep their head down, and they keep working on the issues they know are important. But what does shift is, as the administrators come in, what the people within the agency themselves decide to do. With the first Trump administration, several agencies proactively, before the new administration was sworn in, removed all mention of climate change, reorganized their groups. The agency took those choices themselves. And so it's important to see what the agencies decide they're going to do and how they're going to manage it. I think in health, there's lots of opportunities. We've got this program now at NIH. It could focus more on climate variability. We've got so many problems with extreme events in the US, and that's a focus that needs to take place. And there's lots you can do if you just say that that's your focus, and you don't have to say it's climate change because you don't have to.
Yeah. It is interesting. There are 2 things I think of. One is I think the CDC has 2 political appointees, and it used to have 1, and now it's up to 2.
Yeah.
Huge agency.
Yeah.
So you're absolutely right. The other interesting thing it makes me think of, and I guess I'm going to just ask like how we prevent this, deal with this, is I think it was in 2017, might have been 2018, but under the Trump administration, there was going to be initially a big conference on climate and health at the CDC that then the CDC canceled proactively. And a group of us got together and ended up hosting that conference anyway in
Oh, yeah.
Atlanta. You remember this?
Yes.
And Vice President Gore and kind of helped pull it together in Atlanta. The Carter Center offered up their space. It was great. But all of us were perplexed, like, why did the CDC do this proactively? I can speculate why agencies do this proactively, but how do we help them not do that this time around? That if there is something that was on their health agenda, continue, and then if the next administrator wants to shut it down, let them force you to do that. But the proactive stuff sort of bugs me.
It does. And not all agencies did that.
Yeah.
Quite a number of agencies just went, we'll see what happens. We're not going to we're not going to make any changes. And they went through just fine. And I think agencies learned from that experience that the proactive was not necessarily positive.
Yeah.
And I think it will be different this time. But we'll have to watch what the administrators decide.
Yeah. All right. Questions from the audience? Questions, thoughts? Yep. Just raise your hand. We'll get you a microphone.
Somebody I can't see, but I can see a hand back there.
Yeah, we'll do back there. And we're recording this. This is not being live streamed, but I think for people in our community who might have missed it. And if you could just quickly introduce yourself and then.
Yeah, hi, I'm Maureen Johansson. I'm an alumna of Brown. Building on what you just said, I seem to recall that during the first Trump administration that one way that they were trying to get rid of some of the civil servants legally, get around the rules, is that they moved at least one or two of the agencies down from Washington to some southern state like South Carolina. So the people were given the choice of either, well, if you want your job, you have to move down to South Carolina. So do you recall those incidents?
It was USDA. They moved the Agricultural Research Service, ARS or ARD, and moved it out to Kansas City. And a lot of people quit, with consequences for USDA that still reverberate.
So that could be repeated again now?
It could be repeated again. All of the agencies that work on global environmental change, well, nearly all of the agencies, are part of the U.S. Global Change Research Program, which is mandated by law. And that will continue to exist unless they change the 1990 Global Change Research Act. And they do coordinate and they do talk with each other. And it was a forum for the agencies to exchange their different approaches in the last Trump administration, but it was also true in Bush administrations as well. And as I said, I think they've all learned lessons from the last time, watching agencies that made no change and were not affected, and wondering about the wisdom of some of the changes that they did make in preparation for the first Trump administration.
Thanks. I'm Malcolm. I'm an undergraduate student here. Even if the domestic agencies did learn from the first Trump administration and continue with some of the health and climate agenda, do you think that there's more of a risk for disengagement from the United States on the international front with the COPs or otherwise, with international engagement and cooperation on climate and health?
And can you talk about the withdrawal?
Yeah, I will.
imperative?
Yeah, an interesting factoid is in the Paris Agreement is language about what a country, the conditions a country has to meet to be able to withdraw from the Paris Agreement. And it's a fun conversation to speculate about, but the language is it takes exactly 4 years. And you can just speculate.
How did they pick that number?
Exactly 4 years. And so what happened in the last administration in, January 20th, Trump said we're withdrawing, but the withdrawal doesn't take effect until 4 years later when there was a new administration. There is quite an active group, and I apologize if anybody from that group watches. I don't remember their name exactly, but they're going to be in force in all of the COPs saying we're still here. We're still in, because the US is still in. The other interesting part is even with the statement of the intention of withdrawal, The State Department, who runs our negotiations, still came to all the COPs. And so the US is present. As I said, the COPs are pretty complicated entities. There are large pavilions outside of the COP, and the US had big ones for 4 years. And it had representatives from across civil society talking about all that's going on in the US. The other thing to remember when thinking about climate change is people tend to focus on the international level. The COPs get a lot of attention, it's covered by the media. First of all, the attention is on mitigation, it's never on all the other issues, and so one gets a very false impression of how much progress has been made. And the second is look subnationally. It's just amazing how many thousands of mayors around the world have committed to net zero. I live in a very progressive state, and the progress we're making at the state level makes me want to stay there. There's a lot that is going on. There's subsidies right now for low-income people to buy electric vehicles. They're working on the infrastructure. There's all kinds of changes that are going on. And so look at what's going on at other scales, and you'll see a completely different picture of the level of engagement, how much is being done, and what has been accomplished.
Just staying on this, do you think there is any possibility in the short to medium run that we could get more of a bipartisan consensus, not necessarily on exactly what we should do, but at least on this is a problem, we've got to address it, and then let's fight about how we're going to address it.
Right.
This is sort of maybe my naivete speaking. I keep thinking like we're moving closer to that, but I keep thinking that for like a long time. And at some point, it's either going to happen or I'm going to have to stop thinking that.
Several responses. First, if you haven't, go to Yale and look at the 6 Americas. This is a long-running survey of the opinions of the US population around climate change. And not remembering the numbers exactly, but 75% of the US population knows the climate is changing. 2/3 think the US should be doing something about it. My cynical joke is the rest of them are all in Congress, but you know, the population understands that it's going on. 50% think their health is being affected. A particularly interesting factoid from this is only 1/3 of Americans are willing to talk to anybody else about climate change. So we have a situation where most of the population's worried about it, but they're afraid to talk to each other. And there's quite an effort to increase communication, to get people to have those discussions. I read something else that I found really encouraging within the last week is that the new president is a lame duck president already, that he cannot run again, and that some Republicans are now saying, I got reelected, which is what I wanted to have done, but I don't need to rely on him anymore. And it'll be interesting to see how that plays out, if in fact that's true, and what happens then as they realize that to get elected the next time, they're going to have to rely on new leadership in both parties, but we don't know who those new leaders are. And seeing what's going on, watching, will help us get a sense of whether we can actually get to the place where the American public is, which is we have to address this.
Yeah. Irene.
Irene Papanikolas. I'm the director of the Center for Health System Sustainability. I spend a lot of my time thinking about how countries can learn from one another and work together. And one thing that I find fascinating about the climate challenge is that it impacts countries differently, and it's going to impact parts of countries that they don't know are going to be impacted. And it impacts, storms move from one country to another. I'm from Greece. We had Storm Daniel, I think it was a couple of years ago, come through Greece. I think 4 people died, and then it went to Libya and was catastrophic. And in this, I wonder, we have a history of systems looking within. How did they mobilize their resources to address a problem? But for this challenge, we need to work together. And is there any conversation across countries, and who are the organizations about how we can deploy resources more effectively across places to deal with these challenges as they arise?
It's a very active space and has been for several years, led by the World Health Organization. There are multiple funding proposals going in for adaptation funds that are multi-country proposals. There's new funders that are talking about coming into the space as well, some of the development banks. And they're all set up so you do have countries talking with each other. I was part of a Asia Development Bank project several years ago in Cambodia, Laos, and Vietnam. They all share a problem with dengue fever. They all talked about their dengue control programs. They talked about collaboration. And this was ministry to ministry kinds of discussions. It's hard to track what is going on because it's not anything that will get into the peer-reviewed literature. But it is taking place because they do know that they have to work across borders. It's true in the Middle East. There's quite a lot of discussions in the Middle East about common challenges that they face. And everybody is recognizing that this needs to be facilitated even more so that we can scale up and scale out as quickly as possible.
Yeah. We'll come to you next.
Hi, I'm Avital Strauss. I'm an undergraduate at Brown. I want to touch on what you said just before we started the audience Q&A. I'm curious about the future of research. So, with this new administration, what is it going to look like? What kind of funding opportunities will there and won't there be? What doors are going to open? What doors are going to close? And, in effect, if we do find ourselves in a place where research is not happening at the rate that it needs to be because of the government challenges that we face, what are going to be the health effects of that stagnancy?
One of my biggest complaints about life is nobody gave me a crystal ball. It's just, I bet you could use one too.
Be very lovely. Be very lovely.
The fact is we don't know. If you look in the last administration, there was very little impact on budget in most of the agencies. And if that's, again, true, then things will continue the way they are right now. There's been statements about reducing budgets. It's the House that looks at the agency budgets. And I read something, I can't remember which conservative administration, there was going to be a real efficiency effort, and someone quite respectable was hired to go look at all the different places where there could be efficiencies. And as I recall, it had a list of like 1,200 changes that could be made to increase efficiency across the federal government, and then went to the House. And there was somebody who advocated for the program that they wanted to eliminate, every single one of them. You were not going to get all of those passed because somebody was going to filibuster and say, I need it for my state, I need it for some reason. It's going to be very difficult to make changes. For good or for ill, it's going to be very difficult. And all we can do is just keep moving forward. It's important, as Ashish said, as I've tried to say, you don't want to make proactive changes. You can be prepared to make change, but don't make a proactive change. There may be no reason for it. And so to continue moving forward with applications, with whatever it is you're trying to do with your research. There are lots of philanthropists coming in. They're recognizing that somebody's going to need to fill gaps if there are gaps. And so I think the research agenda is going to do nothing but broaden. It may not be as broad or as fast as we know it needs to be, but it's not going to be going backwards, particularly in a time when we're seeing such rapid climate change and so many people being affected.
I think it's both hopeful and realistic in that I think it is very easy to feel a little doomsy, like it's all going to be terrible. Change at the federal level is hard. And it turns out that that is a feature and a bug of our federal system.
Right.
And there are plenty of things that will continue, and some things might even get better. I mean, I
Yeah.
just think we have to see how it plays out. Craig Spencer.
Hi, my name is Craig. I'm faculty here at the School of Public Health. Thank you for having this discussion. As you're talking, I'm thinking back to a few years ago when I was at Columbia's Mailman School of Public Health, and they famously declared public health is everything, which was confirmatory, but also kind of daunting, because then that meant we had to protect public health from so many more sides. You mentioned that 30 years ago, you and all of your colleagues could fit in a phone booth. Now you could fit in massive convention halls. And it seems like every funding announcement is about climate and something. And I talked to my parents who live in Florida, voted differently than I did, and had to evacuate. My mom is on dialysis, had to evacuate multiple times. And they believe that climate change is real, but maybe not caused by humans, and maybe these things that are out there. My dad says, everything, it seems like everything is caused by climate change. How do you go from climate change being nothing to climate change kind of being perceived as everything? How do you protect that field? And how do you make it so that people are continuously invested, especially given that those gains that you need are not going to come often in the short term?
And as you answer it, can I just
Please.
add an element to this, which may or may not be exactly where Craig is in his question. Very good question. One of the things I've worried about in the space of climate and health, and especially among research, is, and advocacy groups too, like, look, you can care deeply about climate change, I think many of us do, without exaggerating its effects or without suggesting that it is in all these places. And there is a bunch of research, and I think about some of the early malaria research was like not very good research. Like malaria is going to be everywhere. Like no, malaria is not going to be everywhere.
That's right.
It doesn't mean malaria is not going to be anywhere. Like we have to be precise because it's actually in the long run better for the field, even though at times from an advocacy point of view, it feels like, well, you're directionally right, so why not just say it? How do you manage that tension? I wonder if that's a bit of what you're getting at, Craig. But that is a real tension. How have you managed it yourself, and what advice do you have?
So first of all, if climate change is everything, climate change is nothing. And we have to be precise. What is it we're talking about? And the consequences are local. Where, when, how intense. And that varies from place to place. We have a responsibility in public health to provide robust evidence. And frankly, at the moment, we're not. I read too many papers. When I started my MPH, the first week was all about correlation is not causation. And how many papers were published this last week? If I had a temperature data set, I had a health data set, I've got a correlation, therefore it's about climate change. We have to police ourselves. We have to be much more honest about what we know and what we don't know. I've actually started giving lectures now, starting with Bradford Hill, because we've lost that sense of how do we know that something is important for health. And Bradford Hill certainly could be updated, but it is a place to start in thinking about that precision. I mentioned detection attribution studies. Those are going to be critical of saying these are people who suffered, who died because of climate change. And there's lots of associations out there that may or may not be important in the long run. We have to be clear about that. We have to be clear on malaria. There's places that malaria is going to decline because it's going to become too hot and too dry for anopheles. There's places where malaria is already expanding, and it's expanding into highland areas in Africa. Many of the cities in Africa are in highland areas to be above malaria. We're facing a potential catastrophe. Do you know what's going on with dengue this year? Does everybody know what's going on with dengue this year? Dengue started, I'll just focus on the Central and South America, much earlier than it ever has. Last year, there was around 4 million cases of malaria. Right now, it's over 12 million cases of malaria. It has just exploded. 17 cities in Brazil, multiple countries declared states of emergency because of dengue. It's a very challenging situation. 7,000 deaths from dengue hemorrhagic fever. We just haven't seen anything like this at all. Last year was a record with the 4 million cases. There was a detection attribution study. It's in a preprint, and basically probably about 40% of that is because of climate change. At least 40% historically is because of climate change. Goes back to your preparedness question. What I'm trying to get towards is the future is now. The future is going to be different. We have to think ahead. We can't just keep looking historically. What are the challenges that could arise? What is it that we need to do to be prepared? We don't want 7,000 children dying from dengue hemorrhagic fever. But nobody could imagine, goes back to my comment before, nobody could imagine. The Pacific heat dome that hit the Pacific Northwest was accurately forecast, and nobody believed it could be that hot. But we're facing situations where people can't believe, but it is going to happen. And so being clearer about the challenges, being clearer about what we know about what we can do about these, and always focus on the doing part. That this is not research for academic interest. This is research because people's lives are being affected. And so it's different from some of the focus in public health where we're doing discovery research, where we can't afford it. And taking all of this quite seriously, and how can we move forward? How can we help everybody be better prepared, better understand? And how can we activate various networks, communication networks, civil society networks, to ensure that the information is available and we have the human and financial resources to take the actions that we need to take?
Feels like, certainly you're absolutely right that we have to do work that is focused on action and impact. But your point, and you've made this in previous conversations we've had, that it has to still be extremely scientifically rigorous and intellectually precise, because the sloppiness hurts this field in the long run.
It's already hurting it now.
Yeah.
Yeah.
And in the long run, and in the short run,
Right.
you're going to make way more progress by doing the work well. All right, we have like a minute. So one more question goes to Ron Aubert. Dean Aubert, please.
Thank you. What do you think we should foundationally focus on from a curriculum and education perspective as we prepare the next generation of leadership, and also just from a literacy perspective, universally in a university setting, when it comes to the health effects of climate change?
Our Dean for Education.
Transdisciplinarity. A mistake that the health sector is making is that when you look at papers, there are papers with almost 100 authors. They're all health people, and yet they're looking at weather and climate data. You couldn't add one meteorologist or climatologist. 101 is too many, but 100, I'm being facetious, obviously. We have to partner with others because we're making fundamental mistakes in how we use others' data. We can't just go and download a data set, read a couple of papers, and think we know how to use it. And any opportunity to promote that. I spoke with some faculty earlier today. I teach courses on climate change and health. I bring in my state climatologist. He is fantastic. He gives great lectures. And I want to hear from him, not what I think he's going to say. And I bring in quite a few guest lectures from other places, somebody who's in our urban department, or school. It's called Urban at UW. I'm not sure if it's a college or a school, but we've got colleges and schools. But thinking about the capacity you have across campus and bringing that capacity into the classroom. And so students can see the broad range of issues, they can understand from different perspectives, and start understanding as well that if they go on in this field, you've got to have a network. You've got to have people you can call up and say, how do I interpret this? How do I use this piece of data?
But I love the idea of classes that focus on climate and health, not just being taught by public health experts. It's important, but making sure that we're bringing in other experts from totally different fields to enrich that experience.
Yeah.
Thank you for really, not just for coming a long way, which you did, for which I'm grateful, for spending time with us and meeting with a lot of our faculty, but really being the shining light in this field that I think a lot of us have followed. You've just been an extraordinary leader, and I was very privileged to have you here today. So thank you, Chris.
Thank you very much.